Welcome to the Curitics Connect podcast, brought to you by Curitics Health. This podcast is your go-to listen for insights into value-based care, healthcare technology, and the innovations driving better patient outcomes. Each episode will break down complex industry challenges, highlight emerging trends, and speak with experts leading the shift towards the next generation of value-based care delivery programs.
All right. Hello, everyone. Welcome to our very first podcast called Curitics Connects. This has been a very long time coming, and we're super excited to have finally launched it. And today here we have our very first podcast. So I want to introduce you to my co-host, Ryan Weber.
Hey, everybody. Welcome. We are very excited to have finally launched this podcast and to bring you some valuable insights. We'll have some expert interviews, some real conversations about value-based care, healthcare technology, and the innovations driving better patient outcomes. In addition to that, we'll take some feedback from you guys as well, from our listeners, in terms of other topics that you want to hit on. And so we're looking forward to it.
Awesome. I'm going to try really hard not to take sips out of my drink. We are not advertising for Celsius, nor are we promoted and paid by the company, so I'm not going to show it. But either way, I guess let's start by telling the folks a little bit about who we are,
Sure.
Our backgrounds, and what led us to, I guess, be part of the Curitics organization and why we're here today talking to you guys. So I'm going to go first, and then Ryan will kind of jump into your background before we jump into who and what Curitics is. All right, guys, so just a little introduction on myself. Telling your backstory is always a little tough. I'll try not to get too verbose here, but really I kind of want to give you a little insight into who Danielle is and kind of what led me to my current position of Chief Operating Officer here at Curitics Health. So if I rewind a little bit, many moons ago, I grew up, you guys, and Ryan, wanting to be an FBI agent. I spent years, seriously, of my childhood all the way through high school saying, I'm going to be an FBI agent. I knew it. I had the whole thing planned. It was visualized in my head. It was the best thing. I knew when I was going to Quantico, I had it all solved. Then fast forward to actually being in college and in that area of study, and I got an opportunity to actually start seeing case pictures and things that I was like, hold the phone, wait a second, I have to actually see devastation and bad things happen. That's not going to work. Let's put a huge halt on that and change complete position of what I'm going to do for my life, because I realized I'm way too of an empathetic person to even consider that as a career. So long story short, got through college and found myself in the project management space. I had 3 young kids. I was married. I was coordinating tons of chaos at home. I realized I'm really good at this. I mean, I can keep 3 toddlers alive all day and doing stuff. I'm like, I think I'd like this project management space. So I spent many years kind of learning that skill. I was in the real estate development world. Got to work with a lot of unique individuals in their specialties, multidisciplinary. So I really kind of started to understand what it takes to be able to take different groups of individuals and work to a common good to execute on something that you need to get done. And I really loved the start and finish of projects. So over the years, I continued to hone in and working with some different organizations doing project management, portfolio management. I found myself in the healthcare space years after kind of starting my career and started to manage technology projects, so healthcare technology projects. And doing so, I realized that I get to kind of take the best of both worlds. So I was really starting to understand technology and how it was impacting healthcare, as well as utilizing my skill sets with program management and project management. I worked in a couple of years in the third-party administration, really understanding just Taft-Hartley and healthcare and being able to administer your own healthcare benefits and pension benefits. I got to be a part of one of the very first provider portals that were being built many years ago. And that was an awesome opportunity to really get some insight into the impact on the providers and how technology can actually assist them in what it is they're doing. Fast forward years from that, I found myself in the value-based care space. And I think that over the last decade, I've realized this is what I'm truly passionate about, and how it is that you can merge technology and healthcare operations to actually execute on your healthcare program. I'll also tell you, Ryan, I got personally, within this time period, my father had gotten diagnosed with lung cancer. And I got a firsthand, first row seat into what it means to not have coordinated care, and the importance of making sure that we are working together with your providers and specialties, with the care team, with the actual patient and their family members. I found myself running to these different physician offices to pick up lab results and images and take them from one doctor to the next on behalf of my dad. And I thought to myself, my God, there has got to be a better way. Well, there was. Interoperability was starting, but it was still in its infancy. And I think realizing at that point in time, this is not feasible for folks. I think of all the patients out there that don't have family members or support, right, that can do those things, and how traumatic that can be, not only to them, but the outcomes that they're looking for, right? So I realized over that course of dealing with my father's illness that technology done right and innovation can really be impactful to so many individuals that are a part of managing the patient, right? Not only for the patient, but for the provider and for those other individuals that are touching that patient in the different life cycle. So I knew that I wanted to be a part of an organization, no matter what we were doing, but we were continuing to advance technology to help individuals in this space. So fast forward to after different companies and working with different people, I got the opportunity to come over to Curitics. The co-founders and owners of Curitics offered me this awesome opportunity to come and run the operations here. And after seeing what we're doing in this space here at Curitics, I knew I had to be a part of it. So that's how I got here. Thanks for bearing with me as I kind of went through that story a little bit so you could get to know me. But I'm going to pass it over to you, Ryan. And if you don't mind, could you do the same, kind of give your background and let the listeners know a little bit about what makes up Ryan Weber and how you got to this space here today?
Yeah. My road's not quite as long as Danielle. She's a little bit older than I am.
Is that right?
I like to give her a hard time, but no, I'll start back many moons ago, kind of where you wanted to be an FBI agent. I was wanting to chase stars, literally, and my dream was always to be an astronaut. So, oddly enough, whenever I was in high school, I went to a science and math high school, and I got the unique opportunity to do some coding in high school and got C++ certified. So that, in addition to technology, I was always kind of enthralled with it, and just in my day-to-day, I liked video games and computers, and it was always something that was intriguing to me. So I ended up going to school originally to be a computer programmer or potentially going to the engineering school or aeronautical engineering to chase my dream as an astronaut. But that dream got slightly derailed, as though I had a child in my freshman year of high school, and so he is now 20 years old and doing his thing. So I'll date myself a little bit there, but I ended up getting a business degree to essentially get out of school as quick as I could and become a father and provide for my family, and spent many years in sales and marketing, actually, which was, I'd say, a unique experience, but one that has really led me down a path where I feel like my role now is more of the great translator, if you will, from business into the product space and being able to work with the development team, and that has served me really well. So looking back, I find on that time it's very fond of mine. So I really enjoyed that part of my life. When the market went downhill in the late 2000s, I went back to school to become a nurse because there just was not the opportunities that there was at the time, and it was a unique opportunity. My mother was a nurse, and so she was the crux of my decision to get into healthcare. And her entire thesis on it is, you can be a nurse, you like people, you enjoy working with people, you're kind, and that can just spurn who knows what for your career. Because at the time I was a little bit lost as to where I wanted to go next, but I had some smaller children, and I'm like, I need to be able to continue to work and do this. So I was lucky enough to get into Duke's nursing program as a second degree, and they allowed me to work at the hospital while I was in the school. So I got the opportunity to essentially shadow what I was going to do as a future position, which was a really cool experience. So I spent about a decade actually in nursing before, about 7 years in, I decided this career is amazing, but I have to make a decision on where I go next. I had worked at UNC and Duke hospitals in every facet of nursing you can imagine. I used to float around the hospital. I was kind of just like a puzzle piece that would fit in wherever there was a hole, because I loved the idea of just coming in and being in the float pool. So I would go to the ER one day, or I'd go to the psych unit the next day, or I'd go give chemo the next day, and then I'd be in the burn ICU. So I really ran the gamut of nursing.
That's a great experience.
It was awesome. It was really cool. I mean, I loved it. I loved what I did every day, but it was tough on family life. Mm-hmm. It was where I was living at the time. We were about 45 minutes from the hospital. Just from a cost perspective, that was the best place, just where we could live. And you know, those 12-hour shifts get really long, and you can't step away and have, you know, the career you can if you're working from home or even a salary job to just go to a doctor's appointment. You can't do that as a nurse. So I kind of reached this precipice where I was like, I really want to stay in the healthcare space, but I don't know where to go next. And I was lucky enough, I had a colleague at the time who had graduated nursing school with me, and she was working at an EMR company. And she said, hey, we need someone with a clinical background to help test these alerts that we're giving to providers to close these gaps in care. And I had no idea what value-based care was at the time. I interviewed for the position, and I'm pretty sure the manager looked at me like I had 6 heads when she asked me, do you know what a database is? And I'm sure I gave the worst answer of all time. But anyway, they took a flyer on me and brought me in. And that's where my experience started in the healthcare IT space. I was a quality assurance analyst for a few years there, and then went up to a BA, and then I left to join a startup which was really at the onset of value-based care, and that's where I met Danielle, and we became close while we worked together there. She showed me the ropes in terms of project management. I was very much so in the beginning of what would lead to a long career in product and working with data integration and just building relationships with clients and implementations and things of that nature. And from there, my career kind of blossomed. Even though that organization lost some of their venture capital funding, I saw my opportunities expound because of where I was in the space. And much like Danielle, I fell in love with the idea of like, okay, here we have something different than your traditional fee-for-service. I come in, I have a problem, please fix my problem, but rather the opportunity to say, here is this foundational issues that are on the table, they're chronic. What can we do to manage those foundational issues in between your visits and have better outcomes as a patient? So it really gave me at least a sense of purpose in my healthcare career to be able to stay in that space and continue to work towards something that I felt passionately could make a difference. Fast forward, I'll go a little bit ahead here. After Danielle joined, she made a phone call and asked me, hey, can you come help us with this? And I slowly started to kind of whittle my way into the organization over time as a contractor and more responsibility. And now, I work hand in hand with Danielle on a day-to-day basis, primarily focused on our clinical product and also implementation. So it's a pleasure to be here. I love what we do every day, and I'm looking forward to sharing that with everybody.
Thanks, Ryan. Well, you got a little bit of background on who and what we are as individuals. Any of our clients that work with Curitics, they know Danielle and Ryan, as well as other members of our team. But as we'll kind of be the hosts of this podcast, you'll continue to hear us, and we'll be kind of leading the conversation with those in our industry and even out of our industry, but maybe touch it on the peripheral. Would make sense to kind of have them on and talk. I think just real quick, I'd like to give you guys a little bit of background for those of you that don't know what Curitics is and who we are. Just a little insight into the Curitics Health solution. So we are a technology system really for value-based care organizations. The ethos behind Curitics essentially is how is it that we can take multiple technology products that are on the market today, like point systems that are doing different pieces within the value-based ecosystem, and connect those all into one technology solution, which would allow organizations essentially to have a one-stop shop, right, when it comes to a technology vendor. We have spent multiple years in different organizations building these solutions using different vendors that are out on the marketplace, right? Piecing them together to say, hey, we need a telephony system, we need an EMR, we need a data warehouse, we need help with data ingestion, right? So you spend all of this time going out, locating these different vendors, and then working to integrate them so that they all talk to each other. So the idea behind Curitics was, let's do this ourselves. There has to be a better way to do it, a more efficient way, a more affordable way that allows organizations to scale not only their user base, but membership over time. And there lies kind of the foundation and the thought process about Curitics.
Absolutely. Yeah, we also took into account a lot of what we've learned over the years with the individual clients that we work with. You'll come to find out throughout this podcast, a lot of us have worked together in multiple places at this point, and the problems are all the same. The challenges are all the same. The issues that stem from those often end up in dollars and cents and users' frustration, because you end up with a system that has these third-party integrations, and the third-party integrations have limitations, and there's always this crux of, hey, we want this new product, we want this new feature, and we want to change this configuration. You have to take it back to the dev team. You have to do all of the iterative approaches to that. What we wanted to build is something that puts the power back in the hands of the clients that we work with, so they can do their own configuration. They can work together with their team to build models of care and different platforms and forms and everything that they're doing on a day-to-day basis right there within the tool in a self-service model. And as of late, we're integrating AI as well, which is really changing the behavior of how you're able to quickly integrate and elaborate upon what you're trying to do in a very iterative manner within the tool, without ever having to leave, without having to come request anything from our development team or from the people that we work with on a day-to-day basis. So we're trying to empower our clients, in addition to solving the challenges that we've seen along the way, in a singular tool, or really we have multiple platforms, but across those two platforms, the same vision applies.
Yeah, thank you for going a little bit deeper there. So I think, to work to wrap this one up, this first one, I want to let listeners know, what can you expect from this podcast? I think we have a vision as to what we want to do. I imagine that will expand and change over time, because that's just who we are, right? We never stick to one path. But I think the ultimate goal is to have a discussion space to be able to bring in individuals that understand the value-based care ecosystem, that understand the importance of technology in this space, to really talk to those individuals that are driving innovation and change, that may be actual clients that we have, or other individuals that have technology solutions as well. But we want it to be a collaborative space where we can ask kind of some of the questions that many people have out there, some tough questions, some funny things. We're going to work really hard to watch our language from time to time. We tend to drop a couple bombs every now and then, but Ryan and I will work on that. But we don't want it to be uptight. We just want to talk, and we would love to hear from you as far as additional people that you think that we should have on the podcast, and just to kind of talk through some things.
Yeah, and I think we're hoping to learn with you all along the way. Some of the folks that we're bringing in are colleagues of ours, and those folks that are experts in a particular portion of this field that I really feel like do an incredible job of explaining the ins and the outs of value-based care. Being in this space now for close to a decade, I will say that there's still things I learn every single day. And I really think that there's going to be some valuable conversations that come out of this podcast, some jokes and a good time along the way. But whether you're in like the provider space, the payer space, or you're just someone who's passionate about improving healthcare technology and healthcare IT, I think there's something here for you. So we'd love for you guys to listen along on a weekly basis, or however often we end up getting these out, depending on our schedules and how things come along. But we'll do our very best to give you some informative content and keep it light. So looking forward to it.
Yeah, absolutely. Well, guys, just so you know, kind of what to expect in the next week. We have our next podcast episode. We're going to be introducing you to one of our co-founders, Chris Pimsall. He's the Chief Product Officer here at Curitics. So over the course of the next couple of podcasts, we're just going to kind of do some additional introductions of individuals that are on our team, whether they're actually a part of Curitics today or maybe a part of our advisor board, and then we'll expand from that. We want to make sure that if you're as eager and excited to listen to this, which I know all of you are lining up, please subscribe to Curitics Connects on Spotify, Apple Podcasts, or wherever you listen to podcasts. If you have a topic that you would like us to bring up and talk about, or somebody that you think would be great to interview, please reach out to us. Email us at the email that will be listed with the podcast and let us know. Again, it's important that we hear from the audience so that you are interested in listening to us just talk and we don't just become another piece of noise out there in this space.
That's right. And bear with us while we get our sea legs here, if you will.
Yes.
Right? We're new to the podcasting world, but excited about it. Trying to stay comfortable while having a shining camera on your face is always a challenge.
Right.
But we're looking forward to it. We're going to be bringing, in addition to Chris and Umesh, we will be bringing in some other guests along the way. We'll have Danielle Meldru on, Peter Winston, and Mayong Lee, who are all in different positions leading the charge for healthcare innovation. We're here to bring you more than just this banter between us and about our company. We really want to expand your understanding of value-based care. So stick with us, and we'll be lucky to have you along the way here.
Yes. All right. Until next time, have a great day, everyone.
Thanks, everybody.
Bye-bye.
To learn more about Curitics Health, please visit curiticshealth.com. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services.